They say experience doesn't matter if you don't have the title to back it up. That's what I was told anyway. For years, I watched doctors half my age walk through hospital doors with authority I'd never be granted, no matter how many lives I helped save or how many complications I caught before they turned fatal. I accepted it. That's just how the system works, right? But there's a moment in every person's life when acceptance turns into action, when staying silent becomes impossible. Mine came on a Tuesday afternoon in operating room 3, when a man's heart stopped beating, and the surgeon everyone called brilliant froze like a statue. What happened in the next 8 minutes didn't just save a life. It shattered everything I thought I knew about my place in that hospital, about what it means to be just a nurse, and about the price you pay when you refuse to let someone die because of ego and hierarchy. This is my story, and I'm telling it because someone needs to hear that sometimes breaking the rules is the only moral choice you have left. My name is Laura Brennan, and I've been a surgical nurse for 22 years. 22 years of 12-hour shifts, of holding retractors until my arms went numb, of anticipating what surgeons needed before they even asked. I started at County General in Detroit right out of nursing school, young and idealistic, believing that healthcare was a team effort where everyone's voice mattered equally. That illusion died fast. By year 3, I'd learned to stay quiet, to nod, to execute orders without question. That's what gets you through in a teaching hospital where doctors rotate, but nurses stay, where we're the ones who actually know which attending has a tremor after lunch or which resident panics under pressure. I moved to Boston 5 years ago for what I thought would be a fresh start at St. Catherine's Medical Center, one of those prestigious hospitals where they do experimental procedures and publish papers that change medicine. The pay was better, the equipment newer, but the hierarchy, even more brutal. That's where I met Dr. Richard Westwood, chief of cardiothoracic surgery, a man whose reputation preceded him like a storm cloud. Brilliant, they said. Innovative. A genius with a scalpel. They didn't mention the other part, the part every nurse knew within a week of working with him. He was also condescending, impatient, and convinced that anyone without the letters M and D after their name was essentially furniture with hands. Before I continue, I want to know something from you. Where are you watching this story from? It's always incredible to see people from so many different places following these experiences. Write it in the comments, I really want to know. The first time Dr. Westwood spoke to me, he didn't use my name. He called me nurse, like it was a species rather than a profession. I was checking the instrument count before a bypass surgery, something we do to make sure nothing gets left inside a patient, when he snapped his fingers at me. Actually snapped them, like I was a dog. I needed to swallow my pride every single day in that OR, but I had reasons to stay. Good reasons. My daughter Emma was starting her sophomore year at Boston University, studying engineering, and the tuition wasn't going to pay itself. My ex-husband, well, let's just say his child support checks were more theoretical than actual. This job, as degrading as it sometimes felt, kept my head above water. It kept Emma's dreams alive. So I smiled when I needed to smile, stayed silent when I wanted to scream, and reminded myself that patience is a virtue even when you're being treated like you're invisible. My colleagues knew the deal. Sarah from the recovery room would joke that we should start a support group for nurses who'd been Westwooded, her term for being publicly humiliated by the great doctor. But jokes only take the edge off for so long. The truth was, I'd started to feel something dangerous growing inside me. Not quite anger, not quite resentment, something colder. A determination that one day, somehow, someone would put that man in his place. If this story is gripping you as much as it marked me, take a moment now and subscribe to the channel. We're close to reaching 500 subscribers, and your subscription makes all the difference so more people can discover powerful stories like this one. The day everything changed started like any other Tuesday. Morning rounds, equipment checks, the usual pre-surgical briefing where Dr. Westwood talked at us rather than to us. The patient was Marcus Chen, 61 years old, a high school math teacher who'd been having chest pains for months before finally coming in. Triple bypass surgery, relatively routine for someone of Westwood's experience. I'd assisted on maybe 200 of these procedures over my career. I knew every step, every potential complication, every sound the monitors should and shouldn't make. As we prepped Mr. Chen, I noticed his potassium levels were slightly elevated on the latest blood work. Not dramatically, but enough to potentially cause arrhythmias during surgery. I mentioned it to Dr. Westwood during the safety checklist. He barely glanced at the chart. "It's within acceptable range," he said, his voice dripping with that particular tone doctors use when they want you to know your input wasn't welcome. "Let's not delay the procedure over nothing. I should have pushed harder." That's what I tell myself now, looking back. But you have to understand the dynamic in that room. When the chief of surgery dismisses your concern in front of residents, anesthesiologists, and other nurses, pushing back doesn't make you thorough. It makes you difficult, insubordinate, a problem to be transferred to another department, or quietly encouraged to find opportunities elsewhere. So I nodded, documented my observation in the nursing notes like I was supposed to, and we proceeded with the surgery. If this part moved you as much as it moved me, leave your like now. That way YouTube understands this story deserves to be seen by more people, and it really helps the channel keep growing. The surgery began smoothly. Dr. Westwood worked with the precision that had built his reputation, harvesting the graft vessels, preparing the heart for bypass. I handed him instruments in the rhythm we'd developed over months of working together, that wordless dance between surgeon and nurse where everything flows. For the first 90 minutes, everything was textbook perfect. Then the monitors started telling a different story. Mr. Chen's heart rhythm began showing irregularities, subtle at first, just small variations that the anesthesiologist noted, but wasn't overly concerned about. But I'd seen this before. That elevated potassium I'd flagged earlier was starting to cause problems. The heart muscle was becoming irritable, misfiring. I watched the EKG trace like a hawk, my own pulse quickening as the irregularities became more frequent, more pronounced. Dr. Westwood, I said quietly, trying not to alarm the patient even though he was under anesthesia. We're seeing increasing ectopy. His potassium might be causing cardiac instability. He didn't even look up from the surgical field. The rhythm is stable enough. We're almost done with the grafts, but it wasn't stable. I could see it deteriorating in real time. The spaces between normal beats were filling with dangerous extra contractions, the kind that can spiral into ventricular fibrillation in seconds. My hands started to sweat inside my gloves. Every instinct I'd developed over 2 decades was screaming that we were approaching a critical point, that we needed to stop, stabilize the patient, correct the electrolyte imbalance before continuing. But what could I do? I wasn't the one making decisions. I was just the nurse. Then it happened. One moment, Mr. Chen's heart was beating, irregular, but beating. The next moment, the monitor showed the pattern every medical professional dreads: ventricular fibrillation. The heart's electrical system had completely lost coordination. Instead of pumping blood, the heart was just quivering uselessly in his chest. The alarm screamed. Everyone in the OR froze for a split second, that moment where your brain needs to catch up with what your eyes are seeing. V-fib, the anesthesiologist called out, though we all knew. Starting compressions, I said automatically, moving toward the patient. But Dr. Westwood was right there, his hands still in the open chest cavity. He should have started internal cardiac massage immediately. When the chest is already open, you can compress the heart directly, much more effectively than external CPR. It's a procedure every cardiac surgeon has done dozens of times. But he wasn't moving. His hands were frozen, hovering over the exposed heart. And I saw something in his face I'd never seen before. Panic. Pure, undiluted panic. His eyes were wide, his breathing rapid and shallow. He was having some kind of breakdown, right there in the middle of a code. In my peripheral vision, I could see the residents looking at each other, uncertain. The anesthesiologist was pushing emergency drugs, but without effective circulation, those drugs weren't going anywhere. Mr. Chen's brain was being deprived of oxygen with every passing second. Brain damage starts after 4 minutes. Death follows soon after. I had seconds to decide what to do next. Time did that strange thing it does during emergencies. Everything felt like it was happening in slow motion and at light speed simultaneously. I could hear my own heartbeat thundering in my ears, louder than the monitor alarms. In those frozen seconds, my mind flashed through my entire career. The first code I ever witnessed as a student nurse, terrified and useless. The surgeon in Detroit who'd let me practice suturing on simulation models during lunch breaks because he believed nurses should understand the technical work. The advanced cardiac life support training I'd taken 7 times, always hoping I'd never need it. The workshops on emergency procedures I'd attended on my own time, my own dime, because I wanted to be more than just a pair of hands passing instruments. All of that experience, all of that knowledge, crystallized into absolute certainty. Someone had to act, and it had to be me. I stepped forward, pushing past my paralyzed colleague. "Excuse me, doctor," I said, not asking permission. My hands went into that open chest cavity and found his heart. It felt exactly like I remembered from the simulation models. Warm, the texture of dense muscle but quivering instead of beating. I began internal cardiac massage, using the precise technique I'd learned, but never performed on a living human. Compress, release, compress, release. Firm, steady pressure, 60 to 80 times per minute. Not too hard or you rupture the heart wall. Not too soft, or you don't generate enough pressure to perfuse the vital organs. The room had gone completely silent, except for the monitors and my own breathing. The 15 compressions, 20, 30. My arms were beginning to burn with the effort, but I didn't dare stop or slow down. The anesthesiologist, God bless him, adapted immediately. "Continue compressions," he called out, coordinating the medication pushes with my rhythm. One of the residents moved to assist, supporting my arms, giving me the leverage I needed to maintain adequate pressure. And then, like a miracle I barely dared hope for, I felt it, a flutter under my hands, then a weak contraction, then another, stronger this time. The heart was trying to beat on its own again. "We've got organized rhythm," the anesthesiologist announced, his voice shaking with relief. "Sinus tach, rate 120, blood pressure coming up, 70/40, 80/50. I kept compressing, not trusting it yet, not willing to let go until I was absolutely certain. 2 more beats, 3, 4. The rhythm on the monitor steadied, strengthened. Color started returning to the tissue I could see. Mr. Chen's heart was beating again. Only then did I slowly, carefully, withdraw my hands from his chest cavity. They were trembling so badly I had to grip the edge of the operating table to steady myself. The entire room seemed to release a collective breath we'd all been holding. I looked up at Dr. Westwood. He was staring at me with an expression I couldn't quite read. Shock, definitely. Maybe anger, maybe something else. The residents were looking between us, uncertain about what had just happened or what it meant. We finished the surgery in near silence. Dr. Westwood completed the grafts with mechanical precision, but the confidence, the swagger that usually defined his presence in the OR, had evaporated. I continued assisting, but everything felt different now. The power dynamic that had governed that room for years had shifted in those few minutes, and everyone knew it. Mr. Chen was stable when we closed him up. His heart rhythm had returned to normal once we'd corrected the electrolyte imbalance. He was transferred to the ICU in guarded but stable condition. I wrote up my nursing notes with shaking hands, documenting every detail of what had happened. I knew this wouldn't be the end of it. You don't do what I did. You don't step so far outside your defined role, without consequences. Sure enough, 2 hours later, I was called to the office of Dr. Patricia Moreno, the hospital's chief medical officer. Dr. Westwood was already there, along with the hospital's risk management attorney and a representative from the nursing board. My stomach dropped. This was serious. Career-ending, serious. Dr. Moreno's face was unreadable as she gestured for me to sit. "Laura, we need to discuss what happened in OR3 today. Dr. Westwood has filed a report about your actions during the surgical emergency." My mouth went dry. Of course he had. Of course the man I'd saved from a malpractice lawsuit was going to try to bury me to protect his reputation. But before I could respond, before I could even begin to defend myself, the door opened. The anesthesiologist from the surgery walked in, followed by both surgical residents. "I'm sorry to interrupt, Dr. James Park," the anesthesiologist said, "but I heard there was an inquiry about the Chen case. I have relevant testimony." Dr. Moreno frowned, but nodded for him to continue. What followed was the most surreal 15 minutes of my life. Dr. Park described, in precise clinical detail, exactly what had happened. How he'd observed the warning signs I'd reported being dismissed. How Dr. Westwood had frozen when the patient coded. How I'd performed internal cardiac massage that unquestionably saved Mr. Chen's life. The residents corroborated every word. Then Dr. Park added something I hadn't known. "For the record, this isn't the first time Dr. Westwood has experienced a panic episode during a crisis. There was an incident 6 months ago during an aortic dissection repair. The attending from cardiovascular surgery had to take over. It was kept quiet. The room went very still. Dr. Westwood's face had gone from red to pale. That's not," he started, but Dr. Moreno held up her hand. She looked at me with new eyes. "Laura, you performed a procedure you're not technically credentialed to perform. Under normal circumstances, that would be grounds for suspension pending review. However, given the testimony I've just heard, and the fact that your actions clearly prevented a patient death, I'm not going to pursue disciplinary action. In fact, I think we need to have a larger conversation about protocols, about when nurses should be empowered to act in emergencies, and about ensuring our surgical staff are fit for duty." The investigation that followed revealed more than anyone expected. Dr. Westwood had been experiencing increasing anxiety and panic attacks for over a year, likely connected to PTSD from a patient death early in his career. He'd been self-medicating, hiding his symptoms, and becoming increasingly rigid and controlling in the OR as a way to manage his fear. The hospital administration, facing potential liability for not addressing the warning signs, quietly offered him a deal: mandatory psychological treatment, a temporary leave of absence, and when he returned, he'd work with a supervising surgeon until he was cleared for independent practice. He took the deal. He didn't have much choice. As for me, something unexpected happened. The story leaked to the local news. Suddenly, I was getting interview requests, messages from nurses all over the country sharing their own stories of being dismissed or ignored. The hospital, recognizing a public relations opportunity, made me the face of their new initiative on interprofessional collaboration and empowering clinical staff. They even created a new position, a liaison between nursing and surgical services, and offered it to me. I took it, not because I forgave how I'd been treated, but because maybe I could change things for the next nurse, the next Laura Brennan who knows something is wrong but doesn't have the authority to fix it. Mr. Chen recovered fully. He wrote me a letter from his hospital room saying his students were collecting donations for a scholarship in my name. That letter sits framed on my desk now, because here's what I learned. Being just a nurse doesn't mean being less than. It means being the person who stays when doctors rotate out, who notices the subtle changes others miss, who cares for the whole person and not just the diagnosis. It means having the courage to act when action is needed, even when you're terrified of the consequences. Some days I still wonder if I made the right choice in that OR. Then I remember Mr. Chen walking out of the hospital 3 weeks later to hug his grandchildren, and I know the answer. So now I want to know your honest opinion. Do you think I did the right thing by breaking protocol to save a life? Or should I have followed the rules even knowing what would happen? Write in the comments, because this is a discussion that needs to happen. And if this story impacted you, subscribe to the channel so you don't miss other powerful experiences like this one. Click now on the next recommended video. There's another incredible story waiting for you.